There are 15 new cases of coronavirus in today's numbers. 8 of those were in quarantine during their entire infectious period. 11 are linked to known outbreaks, and 4, the source of their infection is under investigation. 2 cases are in hospital, 1 in ICU. There were just under 41,000 test results received overnight, so 40,737, which is a very significant number, and we thank each and every one of those Victorians for coming forward and getting tested. We've said it many times because it's true, it is arguably the most powerful contribution that you can make in our collective fight against this virus. If you've got any symptoms at all, please go and get tested and do it without delay. Now today we've got some important announcements to make in relation to the vaccine program. Last Sunday we expanded at 9 state hubs and we made AstraZeneca eligible for everyone between 18 and 39, so over 18s could go and get AstraZeneca. They'd go through a process where an experienced health professional would talk to them about their own medical history, and there would be informed consent provided. We've been overwhelmed. Even at just those 9 sites, there's been 10, 12,000 people from that relevant age group, so younger Victorians that have come forward to get their first dose. That's why today we can announce that we aim over the next 5 weeks to get 1 million jabs into 1 million arms, both Pfizer as well as AstraZeneca. That means that AstraZeneca will be available to everybody over 18 at all of our state hubs, all 50 of them. We will expand our drive-through locations. Naomi's going to speak a little bit about Melton and how successful that's been. There'll be 3 more of those, 1 in the west, 1 in the southeast and 1 in the north. This is all about making sure that we get jabs in arms and that all of us play our part in getting to the other side of this. There are 1 million reasons to get the vaccine over the next 5 weeks. We want to break that target, do better than that 1 million jabs. There's every chance we can. And proof of that is the fact that yesterday we had our biggest ever day, 27,427 at Victorian state clinics. That is a fantastic outcome. We need to do just a little bit more than that, and we will be able to get 1 million jabs done, 1 million people vaccinated first and second dose. There'll be some of those will be second doses over the course of the next 5 weeks. It is the most important thing to come forward, to get vaccinated, to play your part, to protect not just yourself, but the people that you love the most, and to give us the freedom that all of us want. Getting to 70%, getting to 80%, that's what we have to work towards, and these 1 million jabs over the next 5 weeks are the best way that Victoria can make a contribution, not just to our state's fortunes, but indeed to that national strategy and to the position right across our country. So those 1 million doses between now and Sunday the 19th of September, that is a significant undertaking, but I'm very confident that we'll have that many people go through the program and perhaps more. Some of the hesitancy that people talk about, I think that a lot of it is talk. I think that particularly younger people are very keen to get the best vaccine they can, and the best vaccine they can get, as the Chief Health Officer reminds us, is the one that is available today. So there'll be experienced health professionals to take you through that process at each of our sites. That'll be rolled out in coming days, and throughout the next 5 weeks we'll have AstraZeneca available for everybody everywhere, as well as Pfizer. Naomi can speak about appointments that are not filled yet, but that overall effort of 1 million jabs, 1 million shots in arms over the next 5 weeks, that's our target, that's our aim, and I'm confident that Victorians will continue to come forward strongly to play their part in protecting themselves and their family, but every single family right across our state and our nation. The response since Sunday, when we made those announcements and expanded eligibility for 18-year-old plus, for those people in their 20s and their 30s, has been very, very strong. To have more than 10,000 people through the program already, when it's only been in 9 sites, says to us that there is very strong demand. Can I just send a shout out to people in their 50s and 60s? I don't know that we're necessarily seeing the same level of interest and the same levels of people coming forward and getting their first, and of course their second doses are just as important to complete that process. As the Chief Health Officer says, the best vaccine is the one that's available today. Consult with your GP, or make an appointment and talk to the experienced health professional, whether it be a pharmacist or a very senior nurse or a doctor at one of our state clinics. And if it's safe for you, if it's the best choice for you, then you'll be making a really important contribution to your own safety and that of the people you love the most. But also in a collective sense, you'll be making a powerful contribution on behalf of all of us. We aim to be, by the end of September, at about that 60% mark. We think that with these million doses, if we're able to achieve that or perhaps do better, that's just in state clinics, GP effort, pharmacy effort will be on top of that, then we are well and truly placed to meet our obligations and in fact exceed them. The quicker we get to 70% will mean the quicker we get to 80%, and then we're in a different world, one where hopefully lockdowns are not part of everyday living, where we still have the virus to deal with, particularly amongst those who do not have the jab, but it's a very different world, and there is every reason, if you want to participate fully in hopefully a much, much better 2022, then being vaccinated is an important part of that. Overall, good test result today, good vaccination result as well. These cases that are mystery cases are a concern to us, but this strategy is working in that we are steadily driving down the number of cases and driving up the number of people, the percentage of cases, of those cases who are isolated away, tucked away, no risk to public health. We want to continue to see that trend continue. But any mystery case is a real challenge for us, and I might now ask the Chief Health Officer to speak to those cases and the epidemiology behind them. And then Naomi's got a few things to add to my comments in relation to the vaccine rollout, and then we're happy to take any questions. Getting vaccinated, making one of these appointments, being one of those 1 million Victorians who goes through for a first or a second dose through state clinics over the next 5 weeks is so important. And I think we will meet that target. I think that we'll be quite surprised, all of us, to see perhaps more than 1 million Victorians get the jab over these next 5 weeks. We've opened up eligibility. We're looking at new and innovative ways of making the program easier to access, and it's never been more important to access it and to not delay, not put it off, but to be part of that program and make the appointment as soon as you possibly can. That's how we get past this and into something very different, something that's much closer to normal.